Hello, my name is Melva Covington. I am the co-founder and managing director of People Empowering People for Inclusion Now. We call that PEPIN. I, along with my co-founder, Tamara Allen, who is the Chief Visionary Marketing Officer, we're honored to welcome you to our Flash Talk series hosted by Ms. Mabel Hung. PEPIN is a Chicago-based African-American female-owned research, recruitment, and technology firm focused on delivering high-tech and high-touch solutions for clinical research, focused on reducing health disparities, improving inclusion, and achieving health equity. There's an exclamation point in the center of our name because it expresses a sense of urgency in addressing the issues of inclusion as well as reducing disparate outcomes. Our value proposition is simple and straightforward. We aim to do three things. The first is to increase inclusion in clinical research. The second is provide evidence and insight that's scaled by digital technologies. And the third is to leverage community-based input and engagement to achieve solutions for research participation, health policy, and better access to innovative care. We do this by building empowered networks, empowered study partners, and empowered data systems in the work that we produce. Now for today, we aim to bring you insight from an innovative leader to discuss their work in science, digital innovation, or healthcare solutions. So we welcome you to sit back, take some time to breathe, and enjoy our flash talk. We appreciate you, and we thank you very much.
Yeah. Hey, everyone. Welcome to today's Flash Talk. We are super excited to bring you a very special session today centered on the critical issue of maternal health. And we have here joining us today Dr. Leslie Farrington, who's an experienced healthcare provider and a passionate advocate for maternal health. She's also the co-founder of the Black Coalition for Safe Motherhood, which is an organization dedicated to improving Black maternal health through both healthcare advocacy and a holistic community support for these birthing families. Dr. Farrington's work has been really pivotal in addressing disparities in care through a community-driven approach. So we are super excited to have her here today to share some of her insights with us. So yeah, thank you, Leslie, for joining us. How are you doing today?
I'm good. Thank you for having me, Mabel.
Awesome. Yeah. So why don't we start off with, a little bit about you? What's something unique or fun about you that you want the audience here to know?
Oh, well, my profession was as OBGYN for 30 years. So now I'm a retired African American OBGYN. And I always say that I'm a birth justice activist and advocate. And a fun fact about me, I have to say, because this just happened a few weeks ago, is I'm a kidney donor. And I donated one of my kidneys, to my husband. And so that's pretty exciting, especially at my age. And so I'm very excited about that.
Okay, that's good to hear, and I really wish you the best to both you and your husband. I hear that Leslie is recovering from everything, so definitely we wish you the very best on that journey. I guess next I kind of want to learn about why you started the Black Coalition for Safe Motherhood and sort of what personal experience have kind of led you to becoming an advocate for Black maternal health.
Well, first I should say that I am the firstborn of a interracial couple in the mid 1950s, at a time when interracial marriage was illegal in many states. And so you can imagine looking at me, I'm white presenting, as some people call it, but I identify as Black. And that's because my father, in his wisdom, and this is a picture of him and my mother, and I think you can see my father was a handsome, dark-skinned man. My mother was a white woman, and I came out looking like my mother. But my dad, in his wisdom, gave me a strong Black identity and quite an education, both through my parents' experiences of bigotry and through his tutelage I got a lot of experience with racism and an intolerance for injustice in general from living with my parents and growing up in an interracial family. So that experience, that intolerance for injustice influenced my work in retirement. I had my first child was born when I was in college, and a midwife caught that baby. And that experience turned me towards wanting to support other women in giving birth. And eventually, I didn't become a midwife, but I had a sort of a midwife sensibility when I eventually became an obstetrician. 8 years later, I went to medical school. 8 years and two more babies later, I went to medical school with the idea of becoming an obstetrician to support other women giving birth. And through the course of my career, things happened in my family. One of my sisters almost died 3 times of pregnancy-related complications. And at the time, I knew that it had to do with racism. And I thought maybe her insurance wasn't good enough. And so people didn't treat her well enough. But knowing what was going on with her as an individual, and then realizing that this was not just her, that in 2014, I learned about the maternal mortality rates were going up in the United States and were higher for Black women than white women, regardless of socioeconomic status, regardless of other risk factors. So I realized that my sister was an example of something that was rampant, which I didn't recognize during my career for the most part. So around that time, 2014, 2015, when that news was big, I started looking at, well, what's the problem? And I knew that the one thing that I could do to mitigate racism and discrimination is to bring a program of advocacy skills building to the Black community. And so that's how I gathered others who had more lived experience than me, who were already in birth justice. And we started working on what became the ACT curriculum. ACT stands for Ask Questions Until You Understand the Answers. And in fact, until you're satisfied with the answers. So ask questions. The C in ACT is claim your space, both physical and mental. That's bodily autonomy and dignity and self-determination. So that's the A, that's a C. There's 2 T's, trust your body and tell your story. And of course, trust your body, don't dismiss what you feel. You know your body best. And tell your story means several things. It means make sure that the person you want to take care of you and to evaluate the problems you're feeling hears you. Make sure they hear you. If they're not listening, get some help. And that's where, advocacy skills for you personally and for your partner or your support person are really key, because a lot of times they are not listening. A lot of times they are dismissing, especially Black women, Black birthing people. So tell your story means make sure you get your message across about whatever's symptoms you're having. Tell your story could also be healing if you've been through a traumatic experience. And it also, others can learn from your story. So we share stories in our ACT workshops. And we talk about what can you do in the situation where you're not being heard? What can you do if they're speaking so fast that you don't know what they said? What can you do? What can you say if you disagree and you want another option from your provider? So there's a lot to tell your story. So ACT is this, it's a potentially life-saving acronym. It's self-affirming and potentially life-saving steps to take to take charge of your care. So our organization was established to promote the ACT curriculum. And part of the curriculum also includes raising awareness about the importance of wrapping a cocoon of support around birthing people. And so that includes their partners, their family members, their coworkers, their church members. Everyone can be part of making sure that we improve outcomes. And doulas, of course, are part of that. They've been shown, doula support has been shown to improve outcomes. And having the care of a midwife also has been shown to improve outcomes. So we don't really do childbirth education, but we are skill building, and we're raising awareness of the importance of support for healing and for better outcomes for moms and babies.
That's awesome. Yeah, Leslie, thank you so much for sharing some of your stories with us. And I think it's definitely an incredible journey, both personally and professionally for you. And I definitely agree with the aspect about, just empowerment and providing that advocacy in general for people to share their stories, and for people to come out with their voice. And I think that's also something we really value at Pepin, is to be able to center people's stories, and really be able to share that with more people. And that kind of creates that ripple effect of empowerment. So yeah, that's super good to hear. And I'm also curious about, I know you kind of touched upon this, but how does your organization sort of approach, community support, and what do you think is the most important aspect when it comes to providing support?
Well, for the specific purpose of recognizing and mitigating discrimination, which is rampant in healthcare.
Yes.
We are saying the entire community can be involved in learning advocacy skills and being there for the person who is accessing healthcare. And this is true not just of maternity care, but really all healthcare experiences. The data shows, the survey shows, the stories that people tell all show that 30 to 50% of African Americans are experiencing discrimination in healthcare settings. So our particular approach is to say, okay, how can we mitigate that? How can we sort of protect the birthing person or the ill person from mistreatment, from substandard care? And that's by raising awareness about the importance of educating oneself about the place where you're going for care, the condition that you're seeking care for. So we say, make sure you have those childbirth classes, learn about pregnancy and birth, learn about midwives and doctors, learn about the hospitals that are in your area, and then go and find the best care possible. So, and advocate for yourself in those settings by saying, well, doc, I understand that you want me to do this or that. Can you tell me more about it? So you stand up for your right to informed decision-making. And this is a way, by just asking that question, you can have that provider look at you as an individual instead of, this is a Black patient. They will start to, so you humanize them and you have them humanize you. And so that's how you build an empathic partnership with the provider. And that's a way to, you eliminate the problem of bias that is almost always there if you're dealing with a non-Black provider and you're a Black consumer of healthcare.
Right.
I hope that answered your question.
Yeah, no, of course. I definitely agree with everything you've said about the process of, educating oneself and then going from there to taking those initiatives to kind of voice their concerns, and make sure that it's also a two-way process.
And it's also there's also having another person, your support person, your patient advocate, if you will,
Right.
could be your sister, could be your partner, could be your doula. Have them there or on the phone. A second person, this is true for almost everyone, you always get better service if someone else is a witness, is there to sort of make space for you to think, to come up with your questions. You share your questions with them. You share your concerns with them ahead of time. And so they can make sure that, oh, did you remember to ask Dr. So-and-so about thus and so? So we really are big on reminding everyone to have that extra person in the room, if not physically, on a device. So
Right.
and they've shown that helps during the pandemic too.
Okay, I see.
Uh-huh.
Yeah, I think that's super important in building a support system with people that you can truly trust.
Right.
So probably most likely a family member or friend.
Mm-hmm.
Yeah, so definitely really good to hear. And I think another thing that might just be that people, they still struggle with trust because of historical stigma. And we've talked about this with another Leslie actually last week.
Oh yeah.
So yeah, I was wondering, what are your thoughts on kind of, building trust in light of some of the historical stigma and injustices in the Black community and the healthcare system?
Well, I would say that in our ACT workshops, that we listen to the stories of uh, lack of trust, of or mistrust, and we don't try to negate those stories. We say, okay, what can we do to get the care we deserve, right? So I would say we're not, uh, we're saying, how can you build a relationship, that a trusting relationship? So that's our approach is how you look for someone who answers certain questions in a way that makes you feel comfortable. So if you
Right.
say, what are you doing? What is your hospital doing to address racism in healthcare? Now, if that doctor gets squeamish, takes offense, you know you're in the wrong place.
Right.
So I don't know if you could call that a way to build trust, but it's certainly it's really the healthcare provider's job to build trust. That's the way I see it.
Right. Yeah, I think it definitely has to kind of start with them, and for them to take that effort to show, and even by like in a small conversation, to make the patients feel comfortable that they are,
Mhm.
considering their concerns, and making sure that they are being fully trusted in the process, and make that a mutual process.
Mhm.
Yeah, so that's awesome. And I guess another question I kind of have is, what do you think is one innovation in maternal health that could have the potential, to kind of just impact the future of maternal health?
Well, I have three things in mind. We need to change the culture of obstetrical care in the United States, and that would require something that's not really an innovation per se, but a reclaiming of midwifery and community-based care and support of birthing people. Think about it. 100 years ago, um, the the birthing process was supported, the pregnancy, the birthing process, the postpartum care was supported by people from the community. The midwife was from the community. The friends and family supported the birthing person, was there for their birth. And we basically need to get back to that. So that was abandoned, or that was virtually eliminated by doctors and hospitals in the early 1900s by saying that midwives were not as good as doctors. And people people listened to that and started going to hospitals. Now, in every other country, they updated midwifery and they continued to use midwives. Every other country in the world uses midwives predominantly for pregnancy and birth and postpartum care. And that's one of the reasons why all the other well-to-do countries have better 6 to 7 times less maternal death than we have.
Right.
So we need to bring midwifery back. That's one thing. And then we need, if we could get more doula support, that would be helpful. And all the data shows that if you integrate midwives back into the perinatal care, that you will see better outcomes, because you see that in the places where midwives are integrated into the care. So we need to bring back midwifery. We need to have more doula support to make up for the fact that we don't have paid maternity leave, we don't have universal health care, we don't have the kinds of social safety nets that they have in Europe, for example. So those are the things that are needed. And we need the obstetricians to embrace both of those changes.
Right. No, I think that's some great insights there about, bringing things back, and really think about what we already have and how can that be further improved with whether it's embracing changes or having more doulas and midwives. And I think Pepin is also in the process, having those conversations with doulas and midwives and really putting a spotlight on them, and
Right.
showing the type of support that they provide. So yeah,
Mhm.
that's awesome to hear. And I think one last question here for you is that what do you think Pepin can do more of, or just anything that you can offer, any insights you can offer for Pepin to be more involved in this space, and what can Pepin do moving forward?
Well, I love the concept of that Pepin has of combining community input with rigorous research and collaboration efforts, and moving that forward around doula support. And I'm aware of the efforts that Pepin is already putting forward in that area. So I'm looking forward to hearing more about whether we would get grants and to further that work. And so that's, yes, so educating the community, working with the community is part of the mission, and I love that.
That's great to hear. Yeah. Thank you so much. Well, that kind of wraps up our flash talk for today. So thank you, Leslie, for joining. And I hope everyone out there had a great time listening to this conversation, and definitely stay connected with Pepin. If you have any further questions for Dr. Farrington, or if you want to stay updated to what Pepin is doing with maternal health and building out our community network. So make sure to check out our website for more information, and also follow us on both Instagram and LinkedIn for more information. But yeah, thank you so much, Leslie, for joining us today.
Thank you for having me.
Thank you.